John Doe looked up from his newspaper, realizing that he wasn't paying any attention to the article he was reading. What a week this had been! He was still exhausted and his head was spinning. It had started out so well. 10 days ago, he flew out to San Diego to attend his son's college graduation, and it had been quite the party. After a round of golf in the blazing sun, he had gone straight to the airport and flown back to Boston. His right lower leg had started to hurt towards the end of the flight, but he hadn't made much of it. However, things took a turn for the worse about 20 minutes after he had started driving home to New Hampshire. He felt short of breath and also noted a stabbing pain in his chest. Worried, he headed straight for the closest ER in a hospital on the way. When the ER doctor assessed John, his EKG was normal, but he had a high heart rate and asymmetric calf swelling, as well as tenderness. The ED physician noted that John had been immobilized in the plane for 5 hours and probably had been dehydrated to start with. John was the kind of person who always enjoyed control over most aspects of his life, including his health. Naturally, when his primary care practice had installed an electronic health record, he had immediately signed up for the patient portal, which allowed him to access his lab and imaging results remotely and allowed him to manage his appointments. Now, this came in very handy. He was able to pull up his medical record on his iPad for the ED physician to check on his past medical history and his meds.